Welcome, friends and dear parents. Welcome again to my YouTube channel, Dr. Nilesh Advice. Today's topic is related to the BCG vaccine. As you are aware, I have prepared the vaccine series videos, and most of the common vaccinations I have included in this video. Rotavirus vaccine, pneumococcal vaccine, those videos are also available on my YouTube channel. This is regarding the BCG vaccine. As you are aware, BCG vaccine is given for the protection of the tuberculosis. Tuberculosis is one of the very common disease in the India, and India is considered as an endemic country for the tuberculosis. Many other countries are not giving BCG vaccine as a routinely because the tuberculosis disease is not that much prevalent in their country. Like in the United Kingdom, they don't give the BCG vaccine to each and every child. But if there are certain specific criteria, like the child is born with the Indian parents or child has stayed longer in the India, then they are giving the BCG vaccine. BCG basically protect the severity of the tuberculosis disease and the spread of the tuberculosis to the other organ. As you are aware, tuberculosis is mainly the disease of the lungs. So the protection of the lung tuberculosis is less by the BCG vaccine, but BCG vaccine protects from the spread of the tuberculosis disease to the other organs like the brain, liver, kidneys, or it prevent the spread through the blood. Now, on next question which parents ask that how this BCG vaccine is given. BCG is injectable vaccine. It is given into the skin. Most of the vaccinations are given into the muscles, but the BCG vaccine is given into the skin. As you are aware, the BCG vaccine is given on the left side of the arm near the muscle known as a deltoid muscle. So just in the skin of arm, we are giving the BCG vaccine near the shoulder. It was given on the left side as a standardization all over. But some countries like the Pakistan giving the BCG vaccine on the right side of the arm also, and some of the countries they are given in the thigh as well. Basically, site doesn't make a difference where you are giving the vaccine because it is given into the skin and it will produce the immunity against tuberculosis. So it is just a matter of the standardization, nothing else. So if the vaccine is given in the another part also, it doesn't affect the protection. So this is the vaccine vial, how it looks like. The BCG vaccine vial, it is like the multi-dose vials, almost 10 or 20 doses are there in one vial. And once we will prepare this BCG vial, at least we have to finish the dose within next 3 to 4 hours. So in 4 hours, we have to give to the 10 or 20 children based on the vial strength. How well the BCG works. So what exactly is the BCG vaccine? Like all other vaccine, BCG vaccine is basically the weakened tuberculosis bacteria. Full form of BCG is Bacillus calmette goring. This weakened bacteria, when we are injecting into the body, so that they will start producing the antibody against this weakened bacteria, and that antibody keeps on multiplying. That's why we will get the immunity. These weakened bacteria are not that strong that they can induce the disease in the patient, but it will provide the immunity to the child. So BCG mainly works by the providing the immunity through the weakened bacteria. How much is the dose of this vaccine? So the dose of the vaccine is very less. It is 0.05 ml to zero point 0.1 ml. It depends on the manufacturer to manufacturer, but most of the countries now using the vaccine manufactured by the SSI Serum Institute. So it contains generally the 0.05 ml. The problem with the BCG vaccine is like all other vaccinations are the intramuscular vaccine. So basically, the skill requirement is less. But for the BCG vaccine, very good skill is needed because it is into the skin. So the nurse who is giving the vaccine or the doctor who is giving, he should be skillful to administer this vaccine so that vaccine will go into the skin. It should not go into the muscle or below the skin, otherwise it will cause the some kind of the reaction. Is there any side effect of this BCG vaccine? As you are aware, all the vaccine has some or other side effect, but always we have to weigh according to the benefits. If the benefits are more than the side effect, or side effect is minimal, or side effect is not endangering the life, then we have to give the vaccine. So common side effects are that once you are giving the injection at that site, some discharge will be get formed, and there will be the recurrent discharge for around 2 to 3 months, and after 2 to 3 months it will form the small scar there. At the site of the vaccination there might be the swelling. This swelling may rupture and form the ulcers, and finally after 2 to 3 times this process happens, then the ultimate scar is getting formed. Fever is one of the important side effect of almost all the vaccine. BCG is also cause some low grade fever. We can give the paracetamol if the child is in the discomfort. Pain at the injection site is also one of the common side effect of the vaccine. Many times in the BCG vaccine, the lymph node surrounding areas lymph node gets swollen. So like in the axilla, we have multiple lymph node. Those lymph nodes are also getting swollen. So maybe you will feel the bulging of the axilla because of this lymph node enlargement. So these are the some of the common side effect of the BCG vaccine. So this picture shows that how the scar of the BCG vaccine looks. So if you will check on your left shoulder also, you will able to see this kind of the scar is getting formed. And this is the lymph node swelling which I was informing about the side effect of the BCG vaccine. So this kind of the lymph node can get bigger into the axillary area. Thank you very much. I hope I have given the important information regarding the BCG vaccine. If you are first time on my YouTube channel, you can subscribe as well, and you can share this video with your friends and the parents and the newly parents so that they are aware about the vaccinations of the patients. Thank you very much.